Hello, my name is Desiree Infante, and I am doing my rural project on mental health in rural America. The mental health crisis has skyrocketed in rural America. The suicide rate has increased 46% just in rural areas. In 2020, according to the CDC, there was nearly 46,000 suicide deaths. Mental health is not a crisis that should be overlooked. It needs to be addressed, and not just metro areas, but non-metro areas as well. To understand what resources are in place, a needs assessment must be done in the local community. To complete a needs assessment, surveys can be done, interviews, questionnaires, vital statistics, data sources such as demographic data, and literature can be used. In local communities, hospitals, such as getting the information of the number of patients each week admitted, placement time to get into mental health facilities, demographic and age of patients, accepting facilities can be used. The police department is another area to get a needs assessment completed. Frequency of mental health phone calls, attempted and actual suicide reports, accidental overdoses, and drug-related arrests are valuable information to understanding the needs of the community. High school is another area where needs assessments can be used to understand the resources at hand. Getting an interview or survey in a high school can help understand the amount of bullying incidents, students with number of missed classes, and resources that are actually available for students to get help if they need. Another area is mental health centers in the local community. Interviewing would be a great way to get an average number of new patients each week, the number of available mental health care providers that are available daily, and the average age of each patient that is admitted. Expected goals for expanding mental health in the rural community of Altus would be to evaluate the need for mental health resources, developing strategies to reduce suicide rates in the community, developing a plan to decrease anxiety and depression in high school students, and overall creating a group or meeting for people in the community to go to. Implementing a mental health program must address a target population. It is vital to take into consideration the characteristics, the needs, the values, and the preferences of the target population for the program. In Oklahoma, the age from 14 to 18 has the highest suicide death rate among males. The needs for the program need to be affordable, acceptable, available, and accessible. Relationships, trust, community, and commitment is vital to the program. Preferences for the program can vary, but being open to the public, anonymity, daily meetings, and around-the-clock access would be beneficial to the program needs. Interventions depending on the program needs and the community needs is vital to the success of the program. Effective motivational adoption can include religion, socioeconomic background, gender, and ethnicity. Cultural adoptions can include educational support to different groups, maintain confidentiality, educate on the lack of understanding and knowledge of the mental health issues, and cognitive adoptions, which can include information on relevant education levels, language adoptions, and appropriate interventions depending on the certain age groups. In Oklahoma, the death rate per 1,000 is skyrocketed among the American Indian and Alaskan Native community. Environmental adoptions can include outdoor locations, social locations, community locations, and anywhere that would make people feel comfortable to be a part of this program. Program content can include language changing, visual adaptations, and modifiable activities depending on the education and social and economic levels of the program attendees. of the program form could tailor toward the specific community needs, asking relevant evidence-based context, and appealing to different learning styles. Implementing a mental health program are very unique. There's no one-size-fits-all strategy. Some implementation considerations are relationship with community partners, such as local hospitals, healthcare clinics, and local healthcare department, recruitment and supervision, ensuring certified professionals, employee history and experience, and hiring some volunteers. Ensuring staff retention is vital. Regular educational and feedback programs will help retain staff. Continuing education will ensure the staff is knowledgeable on the program characteristics. Training for the staff and liability are things that are needed in a program to ensure the satisfactory for the mental health patients. When implementing a mental health program, certain challenges may be presented. Some challenges that can cause issues with a program are cultural and social issues, such as stigma around mental health, lack of trust in mental health professionals, traditional and cultural barriers, and geographical limitations, such as weather, distance, and isolation. Adults in Oklahoma with more than 2 weeks of poor mental health by race include multiracial at 18.8% and Black non-Hispanic at the highest of 19.2%, and Hispanic being the lowest at 10.9%. There are different experimental designs when deciding how to evaluate a program. The quasi-experimental design allows for a compare and contrast of groups who use the given resources and those who don't. This experimental design is used to evaluate the effectiveness of the implemented program. There is a group who uses the program and a control group who does not use the implemented program, and at the end is compared and contrasted. The framework for the experiment helps evaluate the outcome. This examines how well a project achieved the outcomes. Is the program being used? Is there new knowledge and awareness acquired? And to what extent is the program meeting the goals? Without strategies for sustainability, the program most likely would not reach the outcomes. Understanding the different factors to help the program be sustainable is important. Some important things that can be implemented are strengthening partnerships to increase visibility, to stress importance of program message, and to help support the community. Building capacity is also important to maintain a professional level of skills and knowledge in the program. Adequate training is vital for the program to ensure proficiency, and maintain proficiency in the broad number of mental health topics is vital to help the program succeed. There are multiple different funding partners when looking for funding for a program. Two different funding partners are National Institute of Mental Health, which is an organization whose main goal is addressing mental health. This organization not only funds research grants, but also participates in training, career development, and project-centered grants. Another organization and funding partner is Children's Health Insurance Program, CHIP. This program provides comprehensive health insurance for children, including mental health services. This program offers a multitude of services and is very easily accessible. Methods of dissemination is one of the most important factors in getting the program up and running. There are many different ways to share information. A few ways is sharing through social media, creating an online platform to gain attention by sharing platform and local community groups, creating events to market the program, supplying handouts, hosting health promotion events at health fairs and school functions, educating about the services and goals of the program, and also including a sign-up sheet for people wanting to be part of the program that can be followed up later. When disseminating this mental health program, the audience is very important to keep into consideration. In Oklahoma, the middle to high school age groups is where the help is needed most. Ensuring affordability, acceptability, accessibility, and availability is vital to the program's success.